My name is Amy Pierce. I'm a registered nurse in the state of New York, and I'm here today to talk to you about diet planning for patients on dialysis on behalf of the Kidney Foundation of Western New York. How can diet changes help people on dialysis? They can control waste buildup, improve treatment effectiveness, improve quality of life, and improve survival. As you may already know, when you have kidney failure, you have a buildup of toxins and electrolytes in your system that can cause serious health complications. Following an approved diet plan for patients with kidney failure on dialysis may keep toxin buildup in your system at safe levels between dialysis treatments. Keeping toxin buildup to reasonable levels in dialysis treatments can improve the ability for the treatments to clear all the toxins and leave you feeling better. Following proper dialysis kidney-friendly diet may help you avoid life-threatening complications and live a longer, happier life. What changes need to be made to my normal diet once I begin dialysis? Dietitians encourage patients on dialysis to intake high-quality proteins, such as meat, poultry, fish, and eggs. This may be different from your pre-dialysis diet requirements, but things are different now because the dialysis treatment can remove the toxins that are produced by proteins in your body. Protein will help you stay strong and increase your muscle mass during dialysis. Patients experiencing chronic kidney disease may have a buildup of sodium in their blood. Buildup of sodium can cause complications such as high blood pressure and fluid retention. Chronic kidney disease patients on dialysis should aim for 2,000 milligrams or less of sodium per day. Potassium can also build up in the bodies of chronic kidney disease patients on dialysis as well. Too much potassium in the body can cause life-threatening heart complications. It is recommended that dialysis patients avoid foods containing high amounts of potassium. Phosphorus can also build up in the body of patients with chronic kidney disease on dialysis too. Phosphorus can actually pull calcium from the bones, decreasing a person's bone health. So it's recommended that dialysis patients avoid foods containing high amounts of phosphorus as well. It's important to limit fluid intake for patients on dialysis. If you're on dialysis, it means your kidneys are severely damaged or they are not working at all. And this means you cannot properly remove fluid from your body. Limiting fluid between dialysis treatments may help you feel better and prevent cramping or drops in blood pressure during dialysis treatments. Also, if you take in too much fluid between treatments, they may not be able to get all the extra fluid off of you in just one dialysis treatment. Food sources. Sources of protein include meat, fish, eggs, nuts, dairy, beans, and grains. Major sources of sodium in the diet include table salt, packaged foods, canned foods, and processed foods. Try to limit sodium intake by using spices instead of table salt and preparing freshly made foods. Major sources of potassium include tomatoes, potatoes, bananas, bran cereals, dairy, whole wheat breads and pastas, beans, and nuts. It's ideal for chronic kidney disease patients to limit the amount of foods containing potassium. Sources of phosphorus include meats, fish, bran cereals, oatmeal, beans, nuts, fruit punches, canned sodas, and iced teas. It's recommended that patients with chronic kidney disease limit their intake of foods containing high amounts of phosphorus as well. How do you take control of your new diet? Reading labels is very important when you're on a chronic kidney disease diet. Labels tell you how much a serving size is and what nutrients are contained in the food you're eating. In many cases, protein, carbohydrates, and sodium are listed on the food labels. In some cases, potassium and phosphorus are also listed on the food labels. It's important to work with your nephrologist or dietitian to understand the amount of each substance you're supposed to have in your daily dietary intake. It's important to track your foods that you eat so you can ensure you're meeting your daily food intake goals appropriately. It's important to keep track of your fluid as well. Many beverages have the fluid ounces contained within them listed on their label. You can also put your fluid in a special water bottle that has the amount of fluid in the bottle labeled on the outside as well. Please remember that foods such as soups should be counted in your daily fluid intake as well. There are many free online resources that can make cooking on a chronic kidney disease diet for dialysis patients fun. This Sliders Dijon recipe was taken from the Game Day Favorites cookbook on DaVita.com. These were really easy to make using ground beef, onion, Dijon mustard, and sweet Hawaiian slider rolls. Delicious! Following a dialysis diet can improve the effectiveness of each dialysis treatment by controlling toxin buildup in your systems between treatments. Only you can control the food that goes in your mouth, so try to make wise, healthy food choices that follow your dialysis diet plan. For more information, contact the Kidney Foundation of Western New York.